Hands off my health care. Well, I saw the bus drive by the Augusta Free Press office on my way to my United Way board meeting yesterday, and I can understand the sentiment, I guess. You can see me cringing when I say that. The sentiment is really a shill. George Allen, former senator, Ken Cuccinelli, running for Attorney General here in Virginia, leading this effort, at least on this tour, the leg of the tour in Waynesboro on Friday. They're shills for the health insurance lobby, so let's not really pay too much attention to them. They're sort of the circus ringleaders, if you want to say, trying to get our attention and get folks whipped up in a frenzy about something that's not going to happen. And what's not going to happen is government-run health care to any degree that the Republicans this summer were trying to tell people was going to be the case. The reform that we're getting out of Washington from the House and Senate and from the Obama administration is largely a reform that Republicans would feel comfortable with. It's going to be a reform of the health insurance industry. You're not going to see anything that's going to really endanger the health insurance industry from being able to function. The problem is it won't be able to function as is, where they can make profits hand over fist. How about your lingo for keep your hands off my health care? Those guys have their hands all over your health care. 30% margin that goes to nothing other than what the health insurance companies make in terms of profits and margins and that kind of thing. That's where this debate really comes down to. Because there's only 1/3 of this reform that has anything to do with a government option, and that's the creation of a public option, which would take a few years to put together. And that's something that would reach out to people not only who currently don't have health insurance, and we're talking about 47 million people in that respect, but also people like a lot of us watching this right now who have health insurance but have high premiums, have high deductibles, who really don't get much out of their health insurance except for maybe some assurance, and I don't even know if the word assurance is a very safe one, that, well, if something catastrophic happens, perhaps they're going to be taken care of. I don't even know if that's the case because there are so many things that can happen even then that companies can kind of wiggle out of having to pay those premiums. That's called profit margin for those guys. Well, Medicare, Medicaid, VA not going to be affected by this reform. You're going to have a public option that's going to be created that's going to create some sort of a pool that can help folks out. Health insurance companies are going to be forced to do some things differently than they've done in the past. They're not going to be able to cherry pick customers quite as easily. That's, though, why they want government's hands, as they say, off your health care, because the hands are going to be on their ability to make those huge profit margins. Well, hands off my health care, how about get your hand out of the cookie jar? I think that's a better term that we can use as we discuss this issue. It's not about government and a bureaucracy there that's going to do anything to take your health care away from you. The health insurance groups have been doing a pretty good job of that the last 15 or 20 years. You know that. Don't be fooled. That's my daily rant for today. I'm Chris Graham.